Welcome to this week's Medicare Monday. Today we're going to uncover some secrets to paying less for Medicare because let's face it, nobody wants to spend more money than they have to. Did you know that many people on Medicare overpay simply because they don't know about the hidden savings programs, smarter plan choices, and ways to cut prescription costs? Well, today we're going to fix that. The next few minutes, I'm going to walk you through some of the best kept secrets to lowering your out of pocket cost, from getting financial help to choosing the right coverage and avoiding common money traps. Let's get started to put more money back in your pocket. Thomas Family Insurance presents your Medicare Monday. The secrets to paying for less for people on Medicare. Some hidden discounts and savings programs. Let's get started. Medicare costs can add up quickly between premiums, deductibles, co-payments, and co-insurance. It's easy to feel overwhelmed. But here's the good news. Many people are paying more than they simply have to because they don't know about the savings available to them. That's where we come in. In this presentation, we're going to explore real practical ways to lower your out of pocket cost so you can keep more money in your pocket while still getting the care that you need. All right, we're going to take a quick moment to talk about a program that can make a huge difference on your drug cost. It's called Extra Help for Part D, also known as the Low Income Subsidy. This was created as part of the Medicare Modernization Act of 2003, and it went into effect in 2006. Its goal is simple: to reduce prescription drug costs for those on limited income and resources. Over the years, this program has helped millions of Medicare people afford their medicines. Now, in 2025, due to the changes in the Inflation Reduction Act, Extra Help got better. The biggest news: more people now qualify for full benefits. In 2025, individuals whose incomes up to 150% of the federal poverty level can qualify for full extra help. That means if your income is below $22,590 as an individual, $30,660 for a married couple, you could qualify. There's also resource limits, and they also have increased. In 2025, assets like savings, stocks, and retirement accounts must be below approximately $17,600 for an individual and $35,130 for a couple. We are talking about things that can turn into cash. This does not count your house you live in, does not count one vehicle that you drive. Other assets might apply. If you qualify, you'll pay no Part D premium, no deductible, and your copayments for medicines will be just a few dollars. It'll be significantly lower than if you didn't have the extra help. This program can save you hundreds, if not thousands of dollars every year. But most people don't realize they now qualify because of the changes of the qualification. So if you or someone you know is struggling with medicine costs, let's check their eligibility. Applying is free and help is available through Social Security, through Medicare, or us. Don't leave the money on the table. Extra Help is here to make sure you get the medicines you need without breaking the bank. We're also going to talk about some huge savings for those people on Medicare on a fixed or limited income that can help pay their premiums. It's called the Medicare Savings Programs. These programs are funded by both federal and state governments to help some or even all of your Medicare costs go away. But millions of eligible people don't realize they qualify. So if you've ever struggled to pay your Medicare premiums, your deductibles, or your copayments, this is something to look into. So what are the Medicare Savings Programs? They are designed to help people with these limited incomes and assets to afford their Medicare expenses. And there are three main levels of assistance. There is a QMB program called Qualified Medicare Beneficiary. This is the most comprehensive program. If you qualify, you're going to get your Part A and Part B premiums covered, and you won't have to pay deductibles, copayments, or coinsurance. And doctors and hospitals cannot bill you for Medicare covered services. In 2025, you can qualify if your income is below $1,235 a month or $1,663 as a married couple. Very low income to qualify. There's also the SLMB, Specified Low Income Medicare Beneficiary. This will cover your Medicare B premium, which in 2025 is $185 per month. The income limits for this are $1,478 for individual per month or $1,992 a month for a married couple. There's also what's known as a QI, or qualified individual. This also helps pay your Medicare Part B premium, but the funds for this are limited and they're approved on a first come, first served basis every year. The income limits for this are $1,660 a month for an individual or $2,239 a month for a married couple. If you qualify for any of these programs, you will automatically qualify for that extra help we talked about earlier. In order to apply, you need to simply visit your local Medicaid office. These programs are administered by the state that you live in, so call your state Medicaid office first. You can apply online. Some states will allow applications to go through their online web portal. Or reach out to us and we can give you some guidance as well. Or go to your local SHIP office or any other trusted advisor you may know. Most of these organizations will offer free assistance to help you apply. If you're living on a fixed income, there's no reason to struggle with all your Medicare costs. Help is available. Even if you think you might not qualify, it's worth applying for because the worst they can do is say no. So, if you or someone you know could benefit from these programs, let's take some action. Every dollar saved means that's more money for the things that matter most in your life, and that is not Medicare covered events. Many of my clients have income or assets too high to qualify for the programs we talked about earlier. There is still help that's available. There is what is called charity care for hospitals. The ideas of hospitals providing financial assistance is not new. In fact, hospitals run by religious organizations and charities have offered free or reduced cost for centuries. But in modern healthcare, financial assistance became a structured requirement after the Affordable Care Act of 2010. The ACA mandated that nonprofit hospitals must offer charity care and make their financial assistance policies publicly available to maintain their tax exempt status. What does this mean for you? It means that if you have medical bills you cannot afford, there may be help available, sometimes even covering 100% of your cost. So how does it work? Every nonprofit hospital has a financial assistance program, but the income limits and rules may vary. Generally, these programs are going to help low and moderate income individuals, even if they have insurance and can't afford the out-of-pocket cost, or people with very high medical expenses, even if their income is above the typical limits, or uninsured or underinsured patients, reducing or eliminating medical debt. So understanding the federal poverty level is part of this. In 2025, the federal poverty level is based upon a set number. This number is, for our purposes, we're going to talk about the 48 contiguous states in the United States. 100% of the federal poverty level is going to be, for an individual, $15,060. For a married couple, 100% of the federal poverty level is $20,440. This is the base. So when we are talking about 250% of the federal poverty level or 300% or 150%, we are simply taking these numbers times 2.5 or 3 or whatever that is. If you need some help figuring that out, that's what we're here for. So hospitals will often provide partial or full financial assistance based upon that percentage of that federal poverty level. Here's what that means in real numbers. Blessing Hospital offers financial assistance for people that are 225% of the federal poverty level or below, which would be around $33,000 for individual or $46,000 for a married couple. You can get more assistance at 250% of the federal poverty level, but you might end up having to pay a little out of pocket. Barnes, for example, in St. Louis, has a much higher limit. It is 300% of the federal poverty level. So again, for an individual, if you make less than $45,000 a year or $61,000 as a married couple, you can get financial assistance. This is critically important to help reduce your out of pocket expense. Blessing Hospital, Barnes Hospital, Memorial Hospital in Springfield, OSF, almost all of the big players will have financial assistance that's available. So if you run into issues covering your copayments and your medical out of pocket expense, reach out to Thomas Family Insurance and we will do the research and tell you what you need to do. Or call the billing office at the hospital to get updated information. All right, next we're going to talk about getting help for your medicines, even if your income is too high to qualify for the low income subsidy. This is what's called pharmaceutical assistance programs. And these are run by drug manufacturers to provide free or low cost medications for people who qualify. So, pharmaceutical assistance have been around since the 80s when some of the drug manufacturers realized that their low income patients couldn't afford their medications, even the life saving ones. So to address this, companies began to offering patient assistance programs. They call them PAPs, allowing eligible patients to receive medication at reduced cost or even for free. Over the years, the programs have expanded, and today nearly every major drug manufacturer offers some form of assistance. However, many people don't know about these programs, and they could be missing out on some huge savings. Let me give you a few examples. Lilly Cares is a program put out for medicines like insulin, Humalog, Baslogar, or other Lilly products. The Lilly Cares Foundation provides them at no cost. In 2025, the income to qualify for this is below 300% of the federal poverty level. So that means individually, if your income is below $45,000 or $61,000 as a married couple, you can get help with those medications. Even if you're on Medicare and you're struggling with these costs, you might pay nothing or much reduced cost for some of these medicines through the Lilly Cares Foundation. Another example is Bristol Myers Squibb Patients Assistance Program. This is going to help with medications like Eliquis, a very commonly used blood thinner, which is also not cheap. In 2025, to qualify for Eliquis, your income must be at or below 400% of the federal poverty level. What does that mean? That means $60,000 for an individual, $81,000 for a married couple. If you meet these requirements, you might receive Eliquis for free for up to an entire year or ongoing based upon your needs. This can be a huge relief for those people facing huge out of pocket expenses. So, in order to apply, most pharmaceutical assistance programs have simple applications that are available online. You can talk to your doctor's office or reach out to us and we will give you the information as well. You will need proof of your income, so you want to apply before your medicines run out. It may take a while to get this done. So, again, if you or someone you know is struggling with medication cost, don't assume there's no help available. These programs exist for a reason to make sure you get the medicine you need without the financial hardship. Being in Medicare could be great for some, but many seniors pay more than what they have to, simply because they don't know about all the ways they can save some money. I want to share a few key strategies, some I already talked about, that can help keep more money in your pocket while still getting the health care that you need. First, we already talked about checking to see if you qualify for extra help or the Medicare savings programs. Most people don't realize that these programs are there. If your income is below $21,000 as an individual or $29,000 as a couple, you might want to look into that extra help. It is important to save all the money that you can. So the income limits do change. So just because you didn't qualify for before doesn't mean you won't qualify now. You also want to compare your Medicare options every year. This is what you rely on Thomas Family Insurance to do. It is my goal to save you as much money as possible. And these plans do change every year. We had a hectic year last year with the network disruptions and all changes in all plans. So we want to make sure that you have a plan that works best for you. You also would want to compare Medicare Advantage plans to look to see what the lowest out of pocket expenses could be and the extra benefits that might be included, like dental and vision and hearing aids. You'll want to review your Part D drug plans to make sure your medicines are still covered every year and to get the lowest possible cost. Also, see if there might be generics that are available. A licensed agent can help you with these comparisons at no cost. It is important you let your friends and family know that we are here to help them and we do not charge a penny. They do not have to be our clients for us to help. If they decide to do business with us, we will be paid by the insurance company, never from our clients directly. You also want to make sure you use pharmacies that are preferred if your insurance has preferred versus standard pharmacies. That can save you a lot of money over time. If you're paying a lot for your generic medicines, you very well might be going to a standard instead of a preferred pharmacy. Mail order is also another way you can save some money on your generic medicines on many companies. You'll want to compare drug prices to see what is available. You want to use discount programs like GoodRx, Single Care, or the drug manufacturers assistance programs we talked about earlier. You also make sure that you look into financial assistance through the hospitals that you may need to go to. Some places like Blessing Hospital will move their financial assistance over to the pharmacy that they own. Brown Drugs is owned by Blessing Hospital in Quincy. So the people who get the financial assistance through Blessing can get a huge savings on their medicines at Brown Drugs. Nonprofit hospitals have to offer these programs. They're not going to tell you about them, but they are required to offer them. And after all the stuff that they've done to my clients in the area, I don't care if Blessing Hospital in Great River in Iowa loses $1 million because of the crap that they pulled, forcing our clients to have to change their plans. So these are just a few ways that we can save some money, and we are here to help you through this all. Another very, very important one is to avoid scams. Do not answer the phone or give any information over the phone that would include your Medicare number. Every month I have people that I lose because a scam artist convinced them to change their plan. I have several people that are out thousands and thousands of dollars because their medicines weren't covered, or they moved from a plan that had drug coverage to didn't have drug coverage, or vice versa. Never, ever, ever give your real information to a telemarketer over the phone. So Medicare can be very confusing, but with a little knowledge and support from Thomas Family Insurance, we can help hopefully save you a lot of money. Whether it's applying for that extra help, switching plans every year to meet your needs, using discounts, or seeking financial assistance, there are ways to reduce your healthcare cost. If you're unsure where to start, ask questions. I'm not a mind reader. I don't know what you're going through without you sharing that with me, but if you want to know if help is available, let my office know. We are here to help provide you the most value we can, and we want you to spend the least amount of money possible. And when it comes to your Medicare options, you have a choice. You can get your benefits from a telemarketer who calls you randomly at dinner time, the celebrity on TV who doesn't know your name, or a local team that actually cares about you and their business is reliant on keeping you safe. At Thomas Family Insurance, we believe in service before sales. Medicare is not just about picking a plan and letting it go. It's about making sure you get the right coverage for you, pay the least out of pocket possible, and have ongoing support when you really need it. We're going to help you save money when we can. By partnering with us, you don't need to worry about your Medicare options. Let us worry about it for you. We're going to help make sure you have access to the resources and strategies that help save you in multiple areas. Things we talked about, like the Medicare cost savings programs, the extra help, the financial assistance. That is what we are here to help you do. And when you run into those issues, we will be here to support whatever those issues are. Telemarketers will call you, they will read from a script. We're going to take the time to understand your needs. We're going to sit down and talk face to face. The TV commercials have no idea who your doctors are and if that plan is even available in your area. We're here to make sure you can keep seeing the doctors you need to or change plans if necessary. And the call centers are going to disappear after enrollment. We're going to be here to help you all year long, not just this year, but every year moving forward. At the end of the day, you don't just need a Medicare plan, you need a Medicare partner. When you choose Thomas Family Insurance, you're not just picking a plan, you're choosing a team that's going to fight for your benefits, help you save money, and be there whenever you need us. Don't settle for a call center or a telemarketer or a random agent. Put a team that puts you first. All right, I just want to say thank you for allowing us to be able to serve you in your Medicare world. We truly appreciate you taking the time here today to listen to what we have to say about hopefully saving you some money, protecting your benefits, and making the most out of your Medicare. At Thomas Family Insurance, we believe in service before sales because your health and financial well being matter. Whether it's helping you with your plan, fighting cost savings programs, or just answering your questions when you have them, we are here to help. Our business is reliant on being able to offer these programs. So if you ever need assistance, don't hesitate to reach out. We're just a phone call away. Again, thank you for your time. I look forward to helping you in any way that I can. any way that I can. Thank you very much, and God bless.